In this lecture, we will discuss basic terms used to describe various aspects of the cardiac complex on the EKG. Each normal cardiac complex on the EKG is made up of waves, intervals, segments, one complex, and one point. We will define each of these and show where they appear in the cardiac complex. Let's start with the waves. So a wave is defined as a positive or negative deflection from baseline that indicates a specific electrical event. The main waves to be aware of are the P wave, the Q wave, the R wave, the S wave, the T wave, and U wave. Okay, so pretty much P, Q, R, S, T, U. And you can see them here. Okay, so the P wave is defined as the first deflection of the cardiac complex. Okay, and that's right here. This is the beginning of it, and that represents atrial depolarization. We'll talk about all these waves and how they come about in future lectures, okay? But just know the P wave is the first deflection of the cardiac complex, represents atrial depolarization. Then we have the Q wave, okay? And we'll see that these next three waves make up our complex, our QRS complex that we'll discuss in a little bit. Now the Q wave is the first negative deflection after the P wave, okay? So this is the Q wave, first negative deflection after the P wave. So we said this is our P wave, and the first negative deflection after it is this Q wave here. Okay, so that's the Q wave. Next we have the R wave. Okay, and the R wave is the first positive deflection after the P wave. Okay, so again, here's our P wave, and the first positive deflection is our R wave. Okay, now we have our S wave. The S wave is a negative deflection, but this time it's after the R wave. Okay, so again, negative deflection, and this time it's after the R wave. Okay, so not the P wave, but here's our R wave. The first negative deflection after it is this S wave. Now I want you to take note of that because a lot of people will confuse, and especially I did this early on, is the Q and the S. Okay, how to differentiate them. Okay, because if you had a complex that looked like this, okay, and then versus one that looked like this complex has a P wave and a Q wave, an R wave, and an S wave, whereas the one below has a P wave, an R wave, and an S wave. Okay, there is no Q wave here because remember we said a Q wave is defined as the first negative deflection after a P wave, and we don't have that. Okay, we have instead of a negative deflection of the complex, we instead have a positive. So, okay, so that's an R wave, and the one that comes after the R wave we call it an S wave. Okay, so just something to be aware of, just this nomenclature. Now the T wave is the deflection after the QRS complex that we'll discuss soon. Okay, so the QRS complex we'll learn makes up those three waves, and the T wave comes after it, and that's this point here, and that represents ventricular repolarization. Now there's also something called the U wave, and this is a deflection that comes often could be combined with the T wave, or it can come after the U wave, or after the T wave, which is this here. It's not always present, but may sometimes be there in certain conditions. Next we have the intervals, and an interval represents the time between two specific EKG events. The common intervals we measure here are the PR interval, the QRS interval, which is also the QRS duration, the QT interval, the R to R interval, and the P to P interval. Okay, so let's take a look at these intervals right now. I'm going to erase some of this so that we can clear this up. All right, so the first one I want to talk about here is the PR interval. Okay, so this is the PR interval, and that is here in red. Okay, so that represents from the beginning of our P wave up until our QRS complex, so this area here. Most of the PR interval represents AV nodal conduction. Okay, and here's our PR interval, makes up the P wave and the PR segment, which is this portion that we'll talk about next. Next we have the QRS interval, okay? And the QRS interval is from the beginning of our QRS complex that we'll discuss after up until the end of it, all right? That's the QRS interval, or the QRS duration. Next we have the QT interval. The QT interval is made up of the QRS complex, the ST segment, and the T wave, okay? And that's from here up until the end, all right? So it's the QRS complex, the ST segment, and the T wave represents the QT interval. Then we talk about R to R intervals, and this will help when we start to look at regularity of rhythms. So the R to R interval is from one R wave until the next R wave, okay? So imagine that we have one complex here goes up until here, okay? Then we start over again with the P wave and the complex continues. So we're going from one R wave and one complex to the next one, okay? That's called the R to R interval. Then there's something called the P to P interval, okay? Similarly, we take one P wave of one complex and then one of the other, and it's from this point up until the next P, and we call that the P to P interval. Okay, so those are the intervals, the PR interval, the QRS interval, the QT interval, the R to R, and P to P intervals, okay? Next, we have these segments. And a segment represents the time between two specific points on the EKG. Normally, these segments should be isoelectric, meaning they should be at baseline. The main segments to be aware of here are the PR segment, the ST segment, and the TP segment, okay? So let's, again, just erase this. So we're writing all over the place. So again, now we're talking about the segments. Okay, we said the segments is the time between two specific points on the EKG, and the main segments I want you to be aware of are the PR segment that we mentioned earlier that made up part of the PR interval. So this is the PR segment from the end of the P wave up until our QRS complex. Okay, so notice that the PR segment is part of the PR interval, but the PR interval and the PR segment are not the same, okay? Remember, here's our PR interval. The PR segment consists of that and the P wave, okay? We also mentioned this ST segment. So where's the ST segment? Well, it's from the end of our QRS complex up until the beginning of our T wave. That's what we call the ST segment, and that's an area we can look for elevation or depression in certain pathological conditions, whether ischemia, infarction, pericarditis, and so forth. And then we have something called the TP segment, okay? And this is where you take it from the end of from the T wave, okay? So take it from the top, the apex of the T wave, to the apex of the P wave, and we call this right here the TP segment, okay? It's actually labeled right there, all right? Or that's this point right in between. And why is this point important, all right? Well, it's important because some people actually use this segment as the baseline. So again, don't use the apex, use this point until here, all right, where this is labeled. And they use this as baseline because if you draw this through, okay, you can look to see if there's anything above, meaning elevation, or depression, all right? Some areas we would look at that are in the segments. In other words, is the ST segment elevated? Okay, so is this above baseline or is it below? Is it depressed? And the same thing we can do with the PR segment. Is the PR segment elevated or is there PR depression? Okay, remember we said these segments should be isoelectric at baseline. Next, we have one complex in the cardiac in this whole cardiac complex called the QRS complex, okay? And this represents ventricular depolarization and is made up of multiple waves. If you recall, we discussed the P, R, and S waves earlier in this lecture, okay? And or the Q, R, and S waves in this lecture, right? So we talked about the Q wave, the R wave, and the S wave, okay? And these three waves are components of the QRS complex, okay? So the QRS complex made up of the Q wave, the R wave, and the S wave. Now they may not always be present, right? We may have a complex that looks like this, where we have the P wave. Here's our QRS complex. It only has an R wave and an S wave, and there's no Q wave, okay? So they don't always have to be there. And again, this complex represents ventricular depolarization. And again, let's erase some of this here so you can see it. Our QRS complex is this here, okay? And you can see another one of them there, okay? And we look at the QRS complex for dealing with situations looking for like ventricular hypertrophy or enlargement of the ventricles, okay? So remember, QRS complex made up of waves and it represents ventricular depolarization. And lastly, there's one point that I want you to be aware of. It's called the junction point or the J point. And this is where the QRS complex ends and the ST segment begins, okay? So our junction point is this area here, okay? It's the point where the QRS complex ends, which is right there, and where the ST segment, this here, is beginning, okay? So we call that point, again, I'll just erase this so to make it clear for you, okay? The junction point would be right here. We'd call that the J point, okay, or this point right there. And sometimes that could be used for looking at different sorts of elevation in the ST segment if it's above the baseline, and it can also be present in some conditions, whether it's elevated or depressed. All right, let's briefly review what we discussed before we end. So again, we have waves, intervals, segments, complex, and the J point. Okay, the waves that we mentioned were the P waves, is the first positive or first deflection of the complex here. Okay, representing atrial depolarization. We have the Q wave that comes after, meaning the first negative deflection after that P wave. The R wave is the first positive deflection, all right, after the P wave. And then we have the S wave, which is the first negative deflection after our R wave, okay? And those three waves, the Q, R, and S waves, make up our QRS complex, which we said represents ventricular depolarization. We also mentioned the T wave, okay? The T wave representing ventricular repolarization, and that comes after the QRS complex. Then we have the U wave that's not always present, okay? And that's the deflection that usually comes after the T wave. We have the intervals, okay? And these represents times between two events on the EKG. We mentioned the PR interval, okay? Which included both the P wave and the PR segment. We mentioned the QRS complex made up of those three waves, okay? We mentioned the QT interval that is made up of the QRS complex, the ST segment, and the T wave, all right, from this point to here. And then we also mentioned the R to R interval, right, from one R wave to the next, and then the P to P interval, which is from one P wave until the next, so from here until this point. Then we talked about some segments. We had the PR segment, that's part of the PR interval, okay, from the end of our P wave up until the beginning of our QRS complex. We have the ST segment that goes from the end of our QRS complex to the beginning of our T wave. Then we talked about the TP segment from the end of our T wave to the beginning of our P wave, and that is often used as the baseline to see if there's any elevation or depression along the complex. And then we talked about this J point here that comes at the end of our QRS complex and the beginning of the ST segment. Well, that's the end of this lecture. We discussed basic terms used to describe various aspects of the cardiac complex on the EKG. I hope you learned something.